Our dear listeners, welcome to another episode of the Social Entrepreneurship in Africa podcast. I am your host, Dr. Joyce Tamale, the co-founder and CEO of Capital Solutions Limited. It's always wonderful to have this conversation with innovative social entrepreneurs where we spotlight them to share with you what's happening in the African continent. Today's episode will focus on nursing and midwifery education, bridging the healthcare gap in rural Uganda. And today, we are greatly honored and privileged to host Dr. Robert Kalyesubula, the founder of Access. Access in full is African Center for Community Sustainability. And therefore, he will tell you more about Access as we continue our conversation. Dr. Kalyesubula will share more about Access, the mission, the vision, and everything that brought it together to support the rural community in Uganda. Most welcome, Dr. Kalyesubula.
Thank you very much, Dr. Tamale. It's a great pleasure to be here, and we are also very privileged to be partners and beneficiaries of Capital Solutions. So I'm very happy to be here. I'm a medical doctor by training. I'm a consultant kidney doctor and a professor of medicine at Makerere University, and also an adjunct professor at Yale University in the USA. But I'm also the founding director of the African Community Center for Social Sustainability. So I'm very happy to be discussing today.
Fantastic. Our dear listeners, now you can hear the person we have is very experienced, and also with all that experience in medical, he's also willing to give back to the community. A journey we are going to enjoy in this conversation. I am very certain you're going to pick one or two things that you can apply in your community, but also appreciate people who are doing great work in this continent. So as we start off, Dr. Kalyesubula, could you start by telling us a bit about the African Center for Community Sustainability Access? What inspired you as a director to find it, and also what is the mission that has evolved over time?
So the African Community Center for Social Sustainability was founded in 2002, and it really was inspired by my journey as a child. My father died when I was 6 years old from the Ruwero War, and my mother actually disappeared for about 8 years. So I grew up in an orphanage called the Ambassadors of Hope, and these people looked after me very well because I dropped out of school in P3, but then they educated me up to university. I did my medicine at Makerere University, and when I finished, I actually decided to work in Nakaseke district where I was born. But while I was there was this lady who had migrated from Rwanda from the genocide, and she had actually gotten sick from HIV. So when we helped her and found out more, we realized that she had more problems. So we started supporting her. We first gave her a piglet, which she did rear, and it brought more income to her. And so I realized I tried to ask the government, because I was at Nakaseke Hospital, to help me help people with HIV. But at that time I was quite young and no one believed in me. So I went to the community and started the African Community Center for Social Sustainability. The mission of Access is actually to help vulnerable individuals in Africa through provision of health, education, and economic empowerment to create a sustainable future which is owned by the entire community. So that's the mission of Access. Really, we deal with health and wealth to create that. So that's how actually Access was started in Nakaseke.
Amazing. Very, very amazing story. And so Access operates in that rural area of Nakaseke, but I know you reach much more than that. What specific challenges and needs do rural communities like Nakaseke and others face, specifically regarding healthcare?
So the healthcare challenges are actually not only unique to Nakaseke, but they are basically unique to rural areas. Dr. Tamale, you and I know that most of the facilities are actually, healthcare facilities are actually in big towns, but not actually all the big towns of Uganda. The health workforce of Uganda, if I'm not mistaken, actually 80% of it is in the big towns, and about 50% is actually located in the big towns of Kampala. But to compound that, also the training facilities the big universities, until recent, were all located in the big towns of Kampala. So we have what we call the 80-20% reversal divide. 80% of the health workforce is in big towns, whereas 75-80% of the population is in rural areas. So most of the people in rural areas do not get the health services that would be needed, especially the advanced health services. Although the primary health care is available, the majority of advanced services or specialized services are not available in rural areas. So the challenge that these people face is that they have to walk long distances to get to the health facilities, but also when they get to the health facilities, they don't usually have the services they need, like drugs. They sometimes don't have the health workers. We know that about only 56% of the required health workforce is available in most of these areas. So basically, they have double burdens of infectious diseases and then also non-infectious diseases. So that's what I can say for now, part of the challenges these individuals face in rural areas.
Wow. Indeed, I totally agree with you, Dr. Kalyesubula, that these particular problems are not unique to Nakaseke, but they cut across to the different areas. Access to medical care is a nightmare and continues to be. Thank you. So we appreciate the work that you're doing as Access. I have personally visited and I was amazed with the great work, nursing and midwifery education you offer. So with that I was able to see with my eyes, what are some of the key skills and values that Access's nursing and midwifery program focuses on to prepare students for work in these challenging settings?
Yes, thank you very much. So Access was actually founded on the belief that the community has the solutions if they are facilitated to do it. So we use an approach of community-based care. So in fact, before we were to start the nursing school, the genesis of it was that we are training community health workers, which we continue to do. We have trained over 350 community health workers. These are individuals which are also known as village health teams. They work in the communities. And then we are training nursing assistants. So some of the skill sets that we offer to these individuals that we train in our nursing school, the Access Nursing School of Midwifery, they are actually skills that are offered by all other nursing schools. We train them in healthcare, medical provision of medicine, diagnosis, and being able to deliver individuals. But beyond that, our nurses are unique in that we offer them special skills. Part of what they do is to get involved in the work that we do as Access. We send them to rural communities where they are able to witness firsthand what happens to the patients. And then on top of that, with the help of the institutions like the Capital Solutions, we have started social entrepreneurship skills because our nurses need to have employable skills. So we teach them other skill sets like public speaking. We teach them how to initiate projects of their own. And we also give them hard skills like making bread, braiding, and all those other skills like farming. We grow trees and we teach them how to do that. So our nurses get those skills besides, above and beyond what other nursing skills offer. That is what is unique about our nurses. Thank you.
Oh, thank you very much. I've had the numbers. You have been able to train over 350 midwives and nurses, and also that involvement in the community. I had actually wanted to ensure that your graduates of the program are equipped beyond the technical component. You've alluded to a few. Are there any others you would like to share so that we can know you have a comprehensive training program?
So yes, our training program also, we have a DIT registration where there is transfer of other technologies. So our nurses get trained into computer use, and recently we are trying to engage other individuals to teach us programming. They also get exposure to financial management systems. We also have some program that covers record keeping, and then also we teach our nurses on public speaking. We have some partners in Canada who actually help us to teach our nurses on public address, and a few of those other soft skills that they need to actually acquire. But also on top of that, we also teach them on how to write proposals. Some of them participate actually, and we write the proposals together, small grants that can help get exercise programs running so that they initiate their own programs within the school. So those are the extra skills that they actually get.
Right. Good. Very nice. Thank you very much. Now, in terms of appreciating how this has gone and in addressing the healthcare gap, can you share some success stories or examples of how access trained nurses or midwives have impacted their communities?
Yes, we have several of those. Some of our nurses have actually remained with us. We run a clinic, the Life Care Center. So we are now employing actually about 4 of former nurses, and they're actually great leaders. They've established community programs. They work with us in doing public health programs in the community, immunizing young children, providing family planning to those who need it. They also offer care to the elderly, which is called the Jaja program. We have a Jaja program where they offer care along that line. But also, because I also work in big towns, in Kampala, in some of the big health facilities, some of our nurses are actually now working in those big health centers and also in the big hospitals. I've seen some in Nakaseke case. Some have also been taken up by the local government in Nakaseke, where they are offering services. But maybe one of the interesting stories is one of our nurses who actually started a clinic in Chigogwa, having worked for about 3 years. She now established her own clinic and is able to support and deliver babies in the community, which actually shows that once they acquire these skills, they don't only do the clinical care, but they are able to start their own businesses, which is part of the entrepreneurial skills we are talking about now. So that is some of the work we are doing. But also, we are aware that some of our nurses have also gone beyond the borders of Uganda. We have some of our nurses working in Southern Sudan, helping people who have been affected by wars. And so this is what the impact we are drawing. We don't have the impact numbers, but now that we are talking about it, we have an alumnus WhatsApp, so we can actually ask where they are and what they are doing, and perhaps if you give us another chance, we might come back to you with the impact numbers themselves. I submit, Doctor. Thank you.
Wow. Great, great. Thank you so much. That's great impact, creating even more decent jobs while also helping the communities. So, Dr. Kalyesubula, please share with the listeners some partnerships or collaborations that have been most impactful in supporting Access's mission to bridge the healthcare gap.
Thank you very much, Dr. Tamale. So we have several partners. So as I told you, Access actually works across the lifespan. We support mothers when they are pregnant. We support them to deliver babies safely. Once the babies are delivered, we offer health care through the spectrum. But we also have a preschool that supports orphans and vulnerable children to have early childhood development. And once we have vulnerable children, we support them to go to secondary, primary, and also up to tertiary training. Those who are not able to progress through there, we actually offer them the programs that I talked about earlier that help them to get skill sets building. And then those who make it to the nursing school, we are able to that. So basically, what we offer now in the healthcare system is ensuring that we are able to have partners that support us up that spectrum. So we have people who support the orphans program. We have people like the Elma Foundation. Those ones help us to make sure that the children go and stay in school. We have partners like the EKFS. These ones support the non-communicable disease treatment. They help us to treat hypertension, diabetes. We've screened over 16,000 individuals and are currently following up about 3,500 people. And we offer them medication for diabetes, hypertension, and have screened them also for kidney disease. We offer family planning. This is supported by the Sigo Family Foundation. We offer all forms of family planning in the community, and those are the partners that work with us. We also work with the Makerere University, which helps us in the training of nurses, but they also help us to train individuals in doing research. Then we have other partners in Uganda, like your organization, Capital Solutions, because initially we were an organization that was just offering services. But we realized that if you don't have a social entrepreneurship arm, COVID-19 taught us very much. We actually lost about 4 of our 10 partners and realized that we have to generate our own income. We approached the experts, the Capital Solutions, and they actually came and trained all our staff. They also organized our organization to be able to begin generating its income. So our nursing school is now an income generation. Our preschool also generates income. Our clinic also generates income. But we have also started another program, which is the social entrepreneurship program, which encompasses women who have started making briquettes that they are able to sell while saving the environment. They are generating honey, they are making bread, and all those things help to generate income. So we have local partners here. We are also partnering with people from the US who send us international students. Those come and support the health facilities with whom we work, and by training them and also imparting these soft skills that I talked about. Those are some of our key collaborators. So we have a few other collaborators who teach us online. We have a university in Canada, which is the New Vance University, which actually helps us to develop and improve our curriculum, but also help in training our teachers, the teachers who teach at the nursing school. So we have a lot of collaborators that actually come and work with us. We have other partners like KLM. KLM helps us to support the early childhood program. They're actually the ones who have helped us to set up the bakery, which helps to improve and provide bread for our students at the nursing school. But we are also able to sell that bread to get some income to ensure that we are able to offer support to those who are not able to offer school fees. I think those are the collaborators I can talk about right now. Thank you very much, Doctor.
Thank you, thank you. This is very, very good news to our ears, seeing that kind of wide collaboration, partnerships, but also as an NGO choosing to actually start your own revenue generation through social entrepreneurship. I think that is a big thumbs up to you. Well done, and to the entire management of Access. So as we proceed, you've mentioned some of your sustainability strategies, but would like to hear your next 5 years journey, especially in expanding or improving nursing and midwifery education. What does it look like?
So as I told you this, thank you very much, Dr. Tamale. This is a very important question to us. We started as training community health workers. We went to nursing assistants. We started by enrolling nurses and midwifery at a certificate level. Those are the ones that we've asked for. Now we are offering a diploma, which means that we can take in people who are upgrading, but also those who have finished S6 to offer them diplomas. Our next step, and for the next 5 years, is to actually to begin training and awarding certificates in special courses that I talked about. This would be like record keeping, starting up computer programs, and also setting up other programs like dental assistants, and also training laboratory assistants. Those are a few of the other programs we are going to be offering. But also on top of our agenda is trying to set up a nursing university so that we are able to offer degrees to our nurses to that level of nursing. It's not a 5-year plan, maybe 10, but in the 5-year plan, we want to get that started, build up the infrastructure, but also get more staff. Our staff are now in training. We have our staff undergoing masters so that when it comes to time to starting up a nursing school, which is a nursing university, will be able to offer degrees. So in brief, that is what we are trying to do. We also want to expand our program so that we are able to provide training for about 1,000 nurses. We are currently have the capacity of 500 nurses, but we want to expand our capacity to be able to train about 1,000 nurses and midwives at all levels. That's our plan, Dr. Tamale.
Wow, great. Thank you so much, Dr. Kalyesubula. This is an amazing big impact in our continent, and I do hope our listeners, you can hear how impactful some of these innovative African social entrepreneurs are doing great stuff in the communities. And so you mentioned, Dr. Kalyesubula, at some point that Access provides medical care, family planning, support for orphans and vulnerable children. How does this complement the educational program to make it more broader into community impact?
Thank you very much. So, of course, for you're a financial expert. Me, I'm a medical doctor. When we began Access, the three of us, we actually focused on health. That's why we have the Life Care Center. But we later realized that health doesn't work in isolation. So these are the problems because they came from the community. When we were taking care of people with HIV, they died and left orphans. So we had to begin taking care of the orphans. Then when the orphans were taken care of, fed and treated, they needed to go to school. So we established the schools or worked with other people who were around us to do the schools. So some of our nurses, as they are being trained, they actually participate in all the activities that we do. They come and support the life care clinic. They go to the community and immunize students. They go to the community and sensitize to prevent communicable and non-communicable diseases in the community. We have some curriculum which they use. They also participate in providing family planning services as outreaches, the mobile teams, but also we run an immunization program on Friday where part of our nurses who are under training come and participate in the care. But we have also had good partnerships with the Nakaseke Hospital, which is our major training hospital. So sometimes our nurses in training offer health training programs before people go to be seen by the doctors and the clinic officers. They offer them health messages that help them to improve their nutrition, to take care of other children, hygiene, taking care of their eyes, teeth, and all those things. So our programs are all integrated together with the nursing school. We work together and the students are offered the opportunity to see the other activities of Access. They actually also go to schools and offer health talks on the topics that the schools are interested in. So that's how the nursing school supports the Access program. Even in research, the nurses come and participate in research. They know how to collect data. We train them on how to collect data. They go on radio programs and teach the masses. So our nurses are fully integrated into the other Access programs. I submit, Doctor.
Wow, interesting. Great and comprehensive way of delivering impact in the communities. I would like to hear, our listeners would love to know, what is the most important lesson you've learned over your social entrepreneurship journey?
So the most important lesson I've learned, maybe there are two. One is resilience, not to give up with small beginnings. Our nursing school started, in fact, I wish you could see the building we started as. It was just a small building, and that's where we started, but now we have very big schools, classrooms, and everything. But the other thing is that you can't walk this journey alone. You have to look for the other experts who do what they do best. That's where actually Capital Solutions came to us. We didn't know how to manage money, and Capital Solutions came and helped us. And now we're on the right path. Most of these things you are hearing, they were not there over the last 5 years. But when we got the experts to help us, they have streamlined our programs, and now we are more focused. So don't be afraid to ask for help as a social entrepreneur, because there are always people who have walked the journey before you, and they are very willing to support you through that journey.
Fantastic. Dear listeners, you've heard resilience and also working together. You can't walk alone. If you want to go far, move with people and get the right support. So those are very great lessons. Thank you for sharing. Now, again, Dr. Kalyesubula, what does success mean to you?
For me, success actually means being able to help another person get on their feet. And that's what Access is all about. It is about building resilient communities that can create sustainable change, which is owned by the entire community. So if you've had my journey, like many of the listeners now know, I was an orphan. If Rebanate, the man who took us in the orphanage, didn't come, would never have been there. So for me, success is being able to see another person be able to stand on their own. And that's what actually Access does, enabling rural communities to be able to get a sustainable future. That's what success is to me.
Wow. Good. Thank you very much for sharing what success means to you. And again, what message or call to action would you like to share with the listeners, and how can they get in touch and reach out to Access?
So I would like to encourage members who have children that need to be educated, especially those who want to become nurses and midwives or health workers. Access has a very good learning environment, and we also ask you to pass the word round about the Access Nursing and Midwifery School. We have very good teachers, and we are able to offer these services. But also, we offer services in health. We are very good at treating high blood pressure, hypertension, and other non-communicable diseases. But also, if you want to sponsor an orphan, we are currently sponsoring over 450 orphans and vulnerable children. If you want to help an orphan, you can reach out to Access. We are available on the websites. I'm sure through the podcast, Dr. Tamale will also probably share part of the work that we are doing. So basically, we welcome individuals, volunteers, and also those who are philanthropies that are willing to support other Ugandans to grow. Thank you very much.
Thank you so much, Dr. Kalyesubula. We would like to appreciate you for your time. And dear listeners, you've had the impact. It's really grounded, and there are many other people out there that would love to join hands with Access to ensure that these orphans, the 450, can be able to accomplish their education, but also the nurses out there that you may want to sponsor, please bring them to the Access Midwifery and Nursing School in Nakaseke. Again, as we wrap up, thank you so much for joining us on this insightful journey today, dear listeners. It was a privilege to host Dr. Robert Kalyesubula and explore the impactful work the Access is doing in addressing healthcare gaps in Uganda, especially in the rural areas. If Dr. Kalyesubula's story has not inspired you, or it has not touched you, you will actually never know how to touch the lives in the communities. Therefore, we ask you to follow the social media opportunities, the social media platforms for Access on Twitter, they are on LinkedIn, Facebook, and other platforms, so that you can be able to see the great work they are doing in the communities. For us at Capital Solutions, you can find us on Twitter, LinkedIn, and Facebook under at Capital Solutions. And if you have enjoyed this episode, please don't forget to share it with others to hear these inspiring stories that is impacting people in Africa and Uganda especially. Until we meet next time, keep championing social entrepreneurship and making a difference wherever you are. Goodbye and have a good listening to this episode.